Hello parents, students, and staff. I'm Brent Tan, the Assistant Superintendent, and I have with me Mrs. Tan, our district nurse. Mrs. Tan, thank you so much for being here with us. I know your day's really busy. And thank you for, shedding some light in regards to some information regarding our policies and procedures of COVID. So first and foremost, do you mind sharing your credentials and experience in the medical field?
I'm a registered nurse. I've been a nurse for 16 years. I have a bachelor's in nursing, and I have my certification as a pediatric nurse. And I've been working only in peds for the 16 years, so school nursing was, I think, an obvious next step for me.
So when it comes to COVID-19 in the school setting, what is the best way we can keep safe?
So the number one thing we can do is ensure that masks are being worn at all times indoors. And if they're able to wear masks any other time on campus. If your child looks sick or is presenting with some symptoms that you're not sure if you should send them to school, you probably should keep them at home just to watch them and see, what they do. Even if this were non-COVID time, I think if any child is having a fever, a cough that's kind of disruptive, or sneezing uncontrollably, also with any nasal secretions that they might have, if they're unable to blow their nose or not good at washing hands, things like that, they should stay home. And hand washing, talking to your kids about hand washing is really important, because that's a good way to keep everybody from being sick.
So Muroc Joint Unified School District conducts daily cleaning of all high traffic areas. For those who are watching the video, Muroc Joint Unified School District utilizes disinfectant foggers as well as approved COVID-19 disinfectant. Can you please share some information regarding transmission of COVID-19?
So the number one mode of transmission is droplets. So if one is unmasked, talking, laughing, coughing, sneezing, all that, those are modes of transmission. And so, wearing your masks is so important in preventing the spread of droplets. Getting it from a surface, or touching a surface, or contact transmission is really kind of a low way to get it. Again, with hand washing, it's a good way from keeping sick, but you wouldn't really get COVID from touching a surface.
So in regards to Muroc Joint Unified School District's policies and procedures, where are you deriving these guidance from?
So we get our guidance from the California Department of Health. They have their K through 12 guidance, and then we also follow our local Kern County Department of Health guidance.
Can you talk about what Muroc Joint Unified School District has put into place to safeguard our students?
So the reinforcement of wearing masks indoors at all times. And we provide masks for everyone who step on campus, whether they, forget their mask at home, it breaks, it gets soiled. We also ensure that students are eating 6 feet away from each other in the cafeteria, and also provide outdoor seating as well. And we have also increased our nursing staff to 3 nurses full-time, just to provide the extra support that we need to keep our kids safe.
Can you talk a little bit more about contact tracing, the time frame that is involved, and really how Muroc will notify parents?
So we try to notify parents as soon as we're able. Once we get a notification from a parent that their student has tested positive, we immediately speak to their teacher or their teachers and ensure that masks were worn, basically 100% of the time in the classroom. And if we can do so, then we can offer a couple, ways that they could come back to school, whether it be modified quarantine or a full quarantine, just depending on the circumstances.
So could you talk to us a little bit more about the COVID antigen test?
Yes, these are done at school. They'd be given by a nurse or one of our trained staff. It's a nasal swab. It's very simple. Swipe the nose 15 seconds on each side. It doesn't go all the way to your brain. It's not as painful. Actually, the kids who've already done it say, it tickles, maybe they sneeze, but none of them said it's painful, and they've been very cooperative. We're able to result them in 15 minutes, and these tests are good when we have a student that's symptomatic. They kind of work like a pregnancy test in that if you test too early, then there's a chance that we'll have a false negative. But if you do it within a good timing, which is essentially 5 days after exposure, then there's less likely a chance it would be a false negative. And if it's a positive, then it would never be a false positive.
So if Muroc Joint Unified School District has determined a child needs a test, can you walk us through how you would go about gaining consent to test a student?
Sure. So I think at the beginning of the year, we did send out a digital consent. So some parents have already filled that out via email. But if we're testing your class or your child is symptomatic, we would first verify that the consent has been filled out, and then we would give you a call if your student were to say, present in the office or something with some symptoms. We would first check the consent, then we would give you a call, let them know that they're sick, and while we're waiting for you to pick them up, we can offer testing them at that time, and we'll always make sure to touch base with you before we test your kid in that sense. If we're testing your kid for a modified quarantine type of situation, you will have heard from the school nurse on what days your child is expected to test. And again, if it's negative, you probably won't hear from us, but if it's positive, we'll call you right away to pick up your child.
To ensure student safety and mitigate against learning loss, Muroc Joint Unified School District has adopted California Department of Public Health's recommendation regarding quarantine procedures. Could you talk me through the different scenarios?
Sure. So the best case scenario is if we can verify that all the kids in the class were wearing their masks 100% of the time, including the teacher. We can offer what's called a modified quarantine, and that is that your child could return to school the next day, basically. You would just have to consent to them getting tested twice in the 10 days following. We would try to space it out to day 5 and day 10. And we would, again, notify you, make sure we have your consent before testing. Then if that was something that you weren't interested in, they would do a full 10-day quarantine, and we'd give you instructions on when they can return to school. Another example is if there were some time unaccounted for that we couldn't verify that masks were being worn properly, for example, then we can do a shortened quarantine in which your child would stay home for at least 7 days. They would need to get tested outside on day 5 after the exposure. And if that test is negative, they could come back to school on day 8. So instead of doing a full 10-day quarantine, it would be shortened to a 7-day quarantine. And then there would be another scenario in which no shortened quarantine or modified quarantines would be available if, say, for example, there were multiple kids in the class that were showing symptoms or testing positive, or if a teacher were to test positive. So those would be a few of those scenarios.
Thank you. So if parents, staff, or students wanted to kind of run through some of these COVID scenarios, where could they get more information?
So on the Muroc Joint Unified School District website, there is a kind of a scenario builder, if you will, that if you click on it, you can choose different, I guess, options, if you will, to say like if somebody tested positive, but you didn't want to do modified quarantine, and you just kind of click your way through each scenario.
If parents have any questions regarding COVID-19 policies and procedures, who should they contact?
So they can talk to any of the school nurses, give us a call. We'll always call you back. Or you could always touch base with your school administrator, as they all have the same, knowledge that we do.
Well, Mrs. Tan, thank you so much for taking time out of your busy day to kind of go over all of our policies and procedures regarding COVID-19. As Mrs. Tan indicated, that if you have any questions, we're here to help. Please reach out to your site administrators. If they don't have the answer, we have school nurses readily available to answer any type of questions. So, well, thank you so much for tuning in, and we'll see you next week.